And so let's talk about the Schroth method. So what is it?
Yeah. So the Schroth method, for me, it was something that really made sense to me because it's a classification system. So it's used to help identify patients that have risk of curve progression. And curvature progression is typically measured by the degree of the curve from what we call the Cobb angle. A Cobb angle is the measurement from the end of the curve at one vertebrae to the end of the vertebrae on the opposite side. And a curve angle greater than 10 degrees is considered clinically diagnosed as structural scoliosis if it has rotation. Just getting the definitions out there before I go completely into what is the Schroth, so that way the listeners are on the same page. This is different than someone that comes in with like a lateral shift or an acute scoliosis or a functional scoliosis deformity. These are patients that have structural changes in 3 dimensions. And so the Schroth method was developed actually in the 1920s. So it's actually over 100 years old, and it was developed by a woman and then further developed by her children. One became an orthopedic surgeon, one was a physiotherapist, and they set up camps and to work on this method of taking different classifications of different curve types and putting them into 3-dimensional corrections, almost similar to like brace would do. And use these exercises to find a change in the posture and symmetry of the curvatures. And it's the only treatment right now that has been shown to have research supporting it at a randomized controlled trial level to reduce curvature progression risk. And so the method itself is looking at improving postural symmetry through conservative exercises, and then done in a way so that you are creating independence. It's not a passive technique. Someone's not lying on the table and you're mobilizing and manipulating there, or it's just strengthening your core where your core is still promoting the curvature. You're taking the abnormal symmetries of the thoracic and the scapular, and you're bringing it to more symmetrical position, almost like an eclipse, right, where we bring that together. You teach the patient how to do that in multiple different postures and positions, and as a result, you can have the effect that we just discussed.